Hello, I am Buckspot and I am here to talk to you about the overuse and abuse of C-sections in the United States. Mothers-to-be and physicians are taking advantage of the convenience of C-sections. There has been an increase in the number of C-sections being performed in the United States today. Mothers are electing to have C-sections over vaginal births. They have the option of choosing dates of birth while selfishly opting out of the pains of the vaginal labor process, playing victim to society's horrors about natural birth. Obstetricians, on the same side of the spectrum, are convincing mothers to choose C-sections to possibly save time or increase their profit margin. A caesarean delivery is an extraction of the infant, placenta, and membranes through an incision in the maternal abdominal and uterine walls. An extraction. Does that even sound okay? The procedure is performed by an obstetrician, a surgeon, who is not trained in normal births, but is still within his or her scope of practice. A vaginal birth will only require a mother to stay in the hospital for 1 or 2 days, whereas a caesarean demands 2 to 4 days being monitored. Along with prolonged hospitalization, a C-section makes breastfeeding, mobility, and lifting for a new mother quite challenging. That cannot be good for a newborn. In 2010, it was reported that nearly 1 in 3 women have babies by C-section in the United States, compared to 1 in 5 reported in 1995. The C-section was introduced in clinical practice as a life-saving procedure both for the mother and the baby. If the lives of the mother and/or baby are not in danger, the procedure is simply unnecessary. In the year 2008 alone, 673,037 women had an unnecessary caesarean section. Another problem we face at hospitals: pushing the C-section for profit and grease. This is done by a series of interventions, beginning with an epidural and Pitocin. After the two are repeatedly administered to the patient, the baby may enter distress, giving medical staff reason to perform a C-section. It is understood that hospitals are businesses and that they aim for a high turnover rate in patients. However, this should not be in any danger to the patients. It is known that babies born from C-sections are more prone to have breathing problems. So, what can we do to decrease the number of C-sections performed each year? A diagnosis checklist can be created and implemented. If a mother-to-be does not meet the requirements, a C-section should not be the first option. Some examples are if the baby is physically too big or there are multiple babies entering the birth canal. More commonly, if the umbilical cord or placenta is misplaced, a C-section will be necessary. Obstetricians can be trained in natural births. After all, they are surgeons and are good in surgery. This can even decrease the number of malpractice suits. Even a second opinion program can be introduced to hospitals to make sure a mother medically qualifies for C-sections. This method is when another physician comes in and evaluates whether the patient needs a C-section or not. In other countries, this method has already proved successful in lowering unnecessary C-section rates. Overall, expecting mothers must be educated on all birthing options. C-sections should only be for emergency scenarios, not for convenience. In conclusion, the implementation of a diagnosis checklist will virtually eliminate the allowance of mothers to choose a caesarean section for non-medical reasons. Obstetricians should be educated and experienced in natural births, or natural birth be removed from their scope of practice. A second opinion policy will serve as a type of checks and balances for caesarean sections. As a whole, the number of unnecessary caesareans will decrease, lowering risks associated with the procedure for both mother and child. Uncompromising limitations for labor induction must be set in hospitals, terminating the urge for medical staff to increase profit. C-sections should only be for emergency scenarios, not for convenience. Spread the word and thank you for listening. I would like to extend a special thank you to my creator, Sadie Morris.